we can help the doctor with more fact-based information that will help them to diagnose and treat faster than they've ever been able to before in an organized manner at the point of care. And to me, that is magic. I think the whole industry is excited. I mean, I've never heard so many applause and claps as since this health tech ecosystem has come out.
The reason Chris and I are so giddy is there's also hundreds of billions of dollars that are on the table that can get off the table. And we can put it back into effective patient care and more care coordination and all the other stuff we want to do. That's the reason we're giddy, is that this is a once-in-a-generation opportunity to get it right.
New choices, new players, new models of care. You know, consumer-first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered health. I'm Jared Johnson, and this is episode 474. Today we have the Flava of the Week about CMS's health ecosystem. What progress did their latest health tech event represent, and how important is the vision of interoperability that they're creating? I'll talk about that. Then Ryan Howells and Kristen Valdes join me for the first of our annual predictions series to have some fun and offer predictions about consumer health in 2026 and beyond. Stay tuned as they share a vision of how today's health IT policies and investments can make tomorrow's consumer-centered ecosystem a reality. Spoiler alert, it's about implementing open standards. It's time for the awesomeness, y'all. Let's get it.
Flava of the Week.
CMS's latest tech event feels like we might be getting something that we don't hear often in this space: momentum. The event was called From Pledge to Progress and was held on December 9th in Washington, D.C. It was co-hosted by CMS and Clear, and attendees represented health systems, payers, tech leaders, and states. The theme was something simple and long overdue. Interoperability only works when identity works. That line from Clear CEO Karen Seidman-Becker crystallized what the industry's been trying to solve for years. You can't have connected care when every health system, portal, payer, and agency asks people to prove who they are again and again. Sounds pretty simple, right? You can't have modern healthcare when beneficiaries are locked out of their own data because an account recovery process is stuck in 2004. Safe to say, identity is the foundation of the consumer experience. What stood out most from this event was how quickly things are changing. In under 6 months since 60 companies signed the pledge at the White House, CMS and its partners are delivering modernized identity verification for Medicare.gov users, faster data access and fewer logins, reusable high-assurance identity tech rolling out in 2026, state participation for the first time, and integrations with Epic MyChart and major health systems. This is interoperability leaving the PowerPoint phase, and importantly, CMS isn't doing it alone. The event highlighted another thing we don't celebrate enough in healthcare: public-private collaboration that actually works. What's the consumer lens? As consumers, we don't describe our healthcare frustrations in technical terms. We say things like, "Why is this so hard? Didn't I already give you this? Why can't you find my information? I just want this to work." We've heard these things for years from our guests, and most of us have lived it with our own healthcare experiences. Another thing we've reiterated on the show for years is that consumers don't care why healthcare is complicated. They just want it to be easy, accessible, and affordable enough to actually use it when the time comes. From pledge to progress to personal. This is how healthcare finally starts to feel like it was built for the people it serves. So let's keep the spotlight shining on identity, one piece of the health tech engine that seems to power the rest. Because the next era of healthcare is here, and it's defined by who uses identity to connect care around the person. Let's acknowledge the work that's being done right in front of our eyes and not let anything stand in our way of keeping the momentum around identity moving forward. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the Week. Hey y'all, I'm here with Israel Krush, founder of Hyro. Israel, what's an easy to understand example of how an AI agent can help consumers in their health journeys?
A simple section would be the fact that instead of enrolling into Medicaid and proving that you're eligible once a year, you need to do it once every 6 months. Patients don't know that. So we said, you know what, we're going to get ahead of that and we're going to educate patients about some of those changes and try to get them re-enrolled or redetermine their enrollment into those programs programs to make sure that one, they're covered, and two, that the health system gets paid or reimbursed for those patients. So I think that's like a clear win-win where you create an AI agent that is proactively helping both patients and health systems with issues that they face and make, again, the journey a little less complicated.
Thanks, Israel. Visit hyro.ai for more information. That's HYRO.ai. And tell them you heard about it on Healthcare Wrap. All right, everyone, let's get into the flow. So today starts our predictions series. We've been doing this annually for those who've been following or listening for a number of years. This is either year 4 or year 5. It's been so many years, I'm not keeping track anymore, but thrilled to have this series back where we are just bringing on some of the best and brightest truly in the industry and inviting them to share their point of view on what they're seeing and what they think that means for what might be coming to us. When we're talking about the connective tissue and this whole podcast, it's all about making healthcare more consumer-centered. There's so much that has to happen to get us there, and I couldn't think of two better people who believe the same thing and who are working tirelessly every day to make it happen. We have Ryan Howells and Kristen Valdes with us today. Welcome to the Healthcare Wrap.
Hey, Jared.
Thank you for having us.
I think we'll give you both just a moment to introduce yourselves however you want. Let's start with you, Kristen, and then Ryan, and then we're going to dig right into these predictions because I can't wait to hear where we go with things.
Sure. I'm Kristen Valdes, founder and CEO of b.well Connected Health. I'm also a board member of an organization called Karen Alliance that we've been working together for the last decade. And probably my most important and favorite role in life is being the mom of a child with rare disease. So thank you for having me today.
And I'm Ryan Howells. I'm a principal at Leavitt Partners. We're a healthcare federal advocacy and policy organization that's working on effective federal policy. We're the co-founders of the Karen Alliance, which is focused on getting individual consumers digital access to their healthcare data, where, when, and how they want to achieve their goals. And we wrote a paper in March called Kill the Clipboard, and then CMS decided to name their initiative after it, which was really cool, which was helpful. But it was really fun. And these are all ideas, Jared, that you've been talking about for a long time. We just got to get them done.
We just got to get them done. I love that. And the white paper was fabulous. I appreciated having you on a few months ago, right? Shortly after that came out. And momentum is the word that comes to mind. Like, there's some real momentum right now. So without giving anything away, for this series, I'll explain how it works. We just want to have some fun. We just want to offer some predictions on what you think we might see in consumer health. This is based on what you're seeing, where you'd like to see the industry go. I think that's a perfect place to inform our opinions. So let's do it this way. Let's start with maybe just, you mentioned health policy, like the government relations, administration side of things. Maybe we'll just kind of look at stakeholders in the industry and see, like, what do you think you might see from each stakeholder group? And we'll start with the policy / government / administration side.
Well, I think if you look, Jared, at just the last 10 months or so as it relates to digital health interoperability, patient-centric data exchange, I don't think objectively you could look at any other administration and say they've done more in the last 10 months than anyone else. It is astounding. And the pace in which they're moving is astounding as well. Everything from the RFI, the initiative itself over the summer, the creation of more than a dozen different work groups as part of that initiative, 400 plus companies that are involved in it, the access model that was actually just launched this month, and even the FDA Tempo pilot. All of that stuff is just in the last 10 to 11 months. And the pace in which they're moving is unprecedented. And what that means, Jared, is that they are laying the guardrails for how we actually scale person-centric digital health, data exchange, interoperability, and insights, input for the entire country and for each one of us individually. So what it's doing is it's taking a model, Jared, that is just really related to payers and providers and those organizations that service those entities. And now they're adding the consumer to that mix. A lot of the things you've been talking about are things that we've wanted, we've wished for, we've hoped for, right? But these are things that are actually happening. I mean, Kristen is going to tell you about things she has actually done that are live and in production. I think what's really important about this whole initiative, and folks, I think, who are not involved in the initiative said, well, there was a press release over the summer, didn't really see anything happen. 400 organizations are participating, 12 different work groups from the highest levels of every payer and major provider that's involved in this, I can tell you firsthand account, they are actively having teams that are developing this. And you're going to see more stuff happen, I think, certainly next year publicly, where they're going to be able to make announcements because things are live than anything. And I think for those who are kind of sitting on the sidelines, I think they're missing out.
Yeah. Well, I mean, I think yes to absolutely everything that Ryan said. And I will add in that the other big piece that I think goes together with the health tech ecosystem plus access plus tempo is the $50 billion Rural Health Transformation Fund. Because ultimately, the goal that I think we're all trying to achieve who are involved in this is that every American, no matter where they live, will have access to personalized, contextually relevant healthcare from wherever they are. And that has been a goal of healthcare for as long as I've been in it, almost 3 decades now. And we will be able to meet people where they actually are, which oftentimes is in their home, in rural communities, that given the technology and that we have available to us today, that we will continue to see moves towards complete and total transformation to create an ecosystem, a shoppable, transparent ecosystem to consumers. Because if every consumer in the US is wearing some type of a wearable and a sensor, has access to their records, they will have a personalized health concierge in their pocket because of AI and LLMs. And that will allow us to connect people to the pipes of the US American healthcare system, not only to understand what it is they need, both preventatively and reactionary, but also to be able to then access the care that they need in the modality that they need it. So from a policy perspective, if I was a betting girl, and I am, I would say what's coming next is going to be more moves towards transparency. So we put in our RFI recommendation at the beginning of the year that we'd love to see ONC ASDP move meaningful use certification off the EHR itself and onto the APIs that surround the EHR, because technology is just in a different day and place than we were when meaningful use cert was created. And I think that what that does is it opens up beyond data, which we've been talking about for a long time, and into things like scheduling and messaging and RX refills and the ability for apps and digital front doors, even if they are LLMs and chats, to be able to pull from the US delivery system in a way that creates transparency and convenience to consumers. So I would think all policy is going to continue to head in the direction of transparency.
Kristen stole my thunder, Jared. That's all right. That's it. Certifying those APIs, certifying the interfaces is like critical. And we wrote that in our Kill the Clipboard paper. Like, here's the reason why. Let me just expand on exactly what Kristen said. Health systems are dying for the data inside their EHR to be in their cloud instance so they can do things that they need to do outside of their EHR. And so if you do this, then 2 things happen. Number 1, you get innovation outside the EHR much faster, much more flexible, nimble way. A lot of innovators now can have access to the workflow, which is wonderful. But the second thing you do is you have innovation inside the EHR, which is really exciting as well, because the EHR vendors aren't waiting for the government to tell them how to build their system. So you have 2 really important things that are happening at the exact same time. If that happens, because that coupled with the access model where you have payment aligned and outcomes aligned with FDA, they have enforcement discretion, so these apps can actually get to market faster. Then you have digital identity that's actually a thing now that we've been promoting Karen Alliance since 2017. And you then have the ability to unlock the key, so to speak, providers and patients to the information in a FHIR API infrastructure. That's true innovation at that point.
It really is. So I think it could be argued that where we're talking about these policy updates, policy changes, policy announcements could be the source of a lot of the momentum. So what about the hospitals, health systems, provider groups that are kind of responsible now to take that momentum and go with it? Like, where do they fit into even some of the initiatives you both just mentioned? Kristen, you speak to health system leaders very regularly, very frequently. What are you sharing with them or encouraging them to do? I guess, where do they as a stakeholder in this initiative fit in? And like, what do you expect to see from here?
Yeah, I mean, I would say there's different kinds of health systems. There are health systems that are leaning into value-based care in a way that they want to be successful, but recognize that they have to disrupt the way that they do business today in order to make that happen. And some of the long-standing barriers for being able to do that are they couldn't access all of their data in their own clouds to do their own analysis, to integrate digital health organizations easily, and they didn't have a reimbursement model to be able to do that. Those conditions have now changed. And so they are very excited and are thinking about, many of those health systems are thinking about, how do we go beyond the services that we provide today? And how do we provide risk-bearing or capitated models to the employers in my community or into telehealth that can scale nationally so that we can get out to more people with the specialties that we have and that we can offer? How do we think about expanding our services? And then you have other healthcare delivery systems that are in highly competitive environments, not as leaned into the value-based care arena, but are very interested in adopting AI and moving from healthcare to health. How do you get into wearables and sensors and be able to actually monitor people in real time and take advantage of services that can be done in a remote or digital world? So I think that there's really two motivators or changes. And I think we've been a little bit stuck because we've been unable to unleash the data from the EHR systems themselves to be able to have a cloud-based environment where these technologies can be deployed very quickly. And so I do think that for these systems, the conditions changing right now that allow for better access and seamless access of data. And what they're excited about is, believe it or not, it's the unsexy part of healthcare about the administrative things that are actually killing the culture in their organizations. Things like prior authorization being able to be done immediately. I mean, imagine a world where you can see someone's insurance, any type of benefit coverage, prior auth that's already done. You're getting care to the human the way that they need it or want it, including their follow-up care. And then you can get paid from a claims perspective, maybe even same day or predictably ahead of time as the industry can start to move towards the technology pipes that can allow those administrative burdens to be easier and faster. They're here and they work today. And that's exciting because then we can start repurposing a lot of money that we spend on those administration and manual functions today back into clinical care and clinical innovation. And that's where health systems really want to be.
Yeah, there's a whole industry called rev cycle management that shouldn't exist, Jared. There's just a whole industry. It just should not exist. Because why does it exist? It exists because the systems can't talk to each other. And we don't have interoperability. But to Kristen's point, all of the things she's talking about are open standards, right? So the CMS 0057 rule, the 3 prior authorization APIs, that's going to resolve 93%. Early adopters are telling us 93% of your prior authorization problem goes away. What I mean by that is you get a real-time data, you get a real-time feedback on whether or not you need a prior authorization and what the answer is. 93% of the time. So let's get rid of that. Like 93% of the problem, right? Number 2 is digital insurance card. There's 30% of the time someone walks into a health system, they don't have an insurance card. One of the health systems told me they've hired 1,000 people to take care of that. Well, what? Why are we doing 1,000 people? Like, that is insane. Like, why can't we need those 1,000 people in patient care? We do not need them chasing bills that the providers already owed. That's insane. Right? So how do we figure that out to do that? And then how do you get patients more engaged in their health? How do you make sure that they can get online scheduling? How do you figure out the ways that they can be able to engage in their health in a better way? How do you communicate with them in a more seamless way? By the way, both inside and outside your EHR, you have reason to communicate with them in multiple different areas. And so how does that actually start to work? And that type of behavior is something that hasn't existed before. I just want to make sure your audience is clear, Jared. A lot of people kind of come onto these podcasts and say, this is things we wish would happen, or these are things that would happen if you buy my proprietary product. What we're saying is these are things that can happen if you develop and implement open standards. So if I'm a health system right now, the 2 things I'm most prioritizing if we're excited about this, which I hope a lot of health systems are who are listening, is 1, I have to make sure that I have my data in my own cloud and can be able to send that data through these FHIR APIs. I need to have basically an API gateway, an API endpoint. That's your address. That's your new physical address in the digital world. Second thing I've got to do is I've got to make sure digital identity is in place. I've got to know that I am who I say I am and that I represent this specific organization. And when I know those 2 things, then I can ensure that I can get the data that I need, that I'm authorized to receive, and I can get it really in real time using these APIs that power the internet. So those are the 2 things I'm most concerned about. And then to Kristen's point, you're going to be engaged in all this fun stuff. Payer, provider data exchange, person-centric data exchange. All of this can start to happen and be reusable across different use cases.
Hey y'all, I'm here with Sina Arham, founder of Friday's Health. Sina, what do you think is broken in the traditional approach to metabolic health, and what are you doing to flip the script?
Let's be honest, the moment in metabolic health is being driven by the GLP-1 receptor agonist class of medications, right? We finally have something that is addressing metabolic health, obesity, and type 2 diabetes in an elegant fashion, right? It's efficacious, it's manageable for patients. And so I think we're having our moment in metabolic health in that the old guard of tackling metabolic health and obesity has a lot of stigma attached to it, a lot of shame and blame and guilt.
Thanks, Sina. Visit joinfridays.com for more information and tell them you heard about it from the Healthcare Wrap. The one other stakeholder group that comes to mind is consumer health and wellness companies. So a side of the industry that feels like it has been disconnected from the sick care side, the well care side, longevity, wearables, prevention, just preventive care at all. And what I hear you both saying is the network not only can have, like the network already exists, like the ways to connect that into a consumer's ecosystem of health and healthcare exists already. And so what do you expect to see from some of those consumer health and wellness and prevention and like longevity companies in terms of like what might be coming here in the near future?
Yeah, I mean, I think the CMS health tech ecosystem has that entire area just super excited that they can finally accomplish the goals that they set out to accomplish originally. Imagine being able to take clinical information, genetics information, wearable and sensor information, combine all of that with health agents that can be delivered so that engagement is contextual. For far too long, healthcare has been one size fits all, right? Even communications on prevention. It just so happens that everyone in America does not need a colorectal cancer screening the same month of the year. But that's how we approach people. There's nothing personalized about when you reach out to somebody, how you help them manage their families. And it doesn't take that contextual information to engage them. And if it does, it's largely telephonic. We don't have enough nurses in the country to be able to engage people telephonically and get them their preventative care. And if you still continue to rely on the 15 minutes that someone has at the doctor when they're in front of someone, that doctor is going to pick the top 1 to 2 things. Well, what if that person has 15 gaps in care clinically? You can't educate on 15 things in 15 minutes and solve for the problem that brought the patient to your doorstep in that moment. So I think health, wellness, longevity, any type of company that is working on how do we expand from healthcare to health, which is what those companies were really founded on, which does involve prevention. They are going to have real-time trusted relationships with patients and their caregivers all the time, 24/7, and when it's relevant. And now that these open standards pipes can simply alert someone when something in the healthcare delivery system changes on that human, and now that we can create portability with the health tech ecosystem, we can start to put in front of their doctors, hey, since the last time I saw you, here are, since I've had a birthday or something has changed, my evidence-based medicine prevention and screening guidelines that I need to have that you can refer me into or that you can take care of today. Also, here's how, instead of me remembering my symptoms and what's happened since the last time I saw you, here's an actual record of how I slept or what my blood pressure is or what my blood sugars have been consistently, how many times I've spiked or not, and how many times I've needed to use my migraine medicine as an example. So we can help the doctor with more fact-based information that will help them to diagnose and treat faster than they've ever been able to before in an organized manner at the point of care. And to me, that is magic. I think the whole industry is excited. I mean, I've never heard so many applause and claps as since this health tech ecosystem has come out.
Amen. Let's do it. I mean, there's just too much good stuff going on. And the realities of the situation today in healthcare is that, and I'd be very serious about it, like there's a lot of pain going on too. Like there is health plans, health systems, patients, states, a lot of them are experiencing this pain, downsizing, lower revenues, less access. There is a lot of pain. The reason Chris and I are so giddy is there's also hundreds of billions of dollars that are on the table that can get off the table. And we could put it back into effective patient care and more care coordination and all the other stuff we want to do. That's the reason we're giddy, is that this is a once in a generation opportunity to get it right. That's what we're trying to communicate. And so as you're thinking about this, as you're thinking about as an organization, like how do I become more person-centric? It's cheaper, faster, and better than anything you have today in finding ways where you can be able to engage the patient, as Kristen talking about, using these open standards. Everything from real-time benefit check to digital insurance card to digital identity to aggregating all your health information. I mean, the quality measurement at the point of care, all of that stuff is like, it's just all things that were science fiction, Jared, like even just a few years ago. And so The perspective here is we need to get more people in the pool. CMS aligned networks, it's the easiest thing to join in the history of the planet. You literally go to the website, fill out a form, and you're in. So if you're a provider or you're a payer, there is absolutely no reason you shouldn't be in. And if you're a tech vendor as well, get in the pool because you're going to get left behind. This is going very quickly. It's the first public-private partnerships that's fully visible in a Slack channel that I've seen in a decade more. And it's actually, I think, never happened before. But the things that Amy Gleason and her team and Arda and Alberto and Dr. Oz and all this stuff is doing is pretty incredible. And my hope, Jared, is, and I recognize this as well, there's a lot of partisan things that are happening right now. I just hope that people can be really focused on this topic and getting this right, because the idea here, and Anish Chopra is so involved in this and so excited about this. I'm putting words in his mouth, but I don't think he'd mind. The point is, I don't care if you're a Democrat or Republican, get on board here, because we literally have a once in a generation opportunity to get this right. And we've really got the next year to get it really right. And if we don't, we're going to potentially be delayed for another 10 years because we don't know if it's going to be a priority in any other administration, no matter who wins the White House in 3 years. That's the challenge we've got. And it's really a once in a generation opportunity to get it right. Let's do it.
Fantastic. All right, really, real quickly, any guesses on what's going to be the most unexpected healthcare headline of 2026?
I think that consumer access to healthcare information will scale more than we have ever seen in the 2 decades plus that we've actually had really healthcare technology. I think you're going to see more scaling of it in 2026 than we've ever had before.
All right, well, that makes me giddy too. So, Kristen, what do you think?
All right, well, I'll hit the other side then from a health system perspective. I think the headline, at the risk of being spicy, which Ryan loves, is major health systems will begin dismantling their core HR installations in favor of modular, interoperable architectures.
Okay. All right. Well, that's the perfect place to wrap this up. And it also means I want to have you both back on very soon to talk about the progress that we're seeing in the momentum, because there's a lot behind what you both just said. But we are out of time on this. I want to thank you both. Again, I think I've thanked you multiple times, but appreciate the optimism here, the hope, and where you see things going and your point of view on all of this. Thanks for everything you're doing to make healthcare consumer-centered, and thanks for joining us today.
Thanks, Jared.
Thanks for having us.